Good evening and welcome to the COVID-19 update on Channels Television. I'm Kayode Okikiolu. Here are some of the highlights. Presidential Task Force on COVID-19 warns that everyone is at risk of contracting COVID-19, encourages Nigerians to take responsibility. Compliance level to COVID-19 protocols in Nigeria's epicenter, Lagos, seems to be waning as some residents return to life as normal. And scientists in Hong Kong report a case of COVID-19 reinfection in a patient 4 months after first infection, as WHO warns against jumping to conclusions. Thank you for joining us on the program. 1,002 Nigerians, people, in fact, have died from COVID-19 in Nigeria, a grim reminder of the danger posed by the novel coronavirus. Total confirmed cases also continue to rise, according to latest figures from the Nigeria Center for Disease Control, NCDC, with 322 new cases across 17 states and the FCT. The nation has now recorded 52,227 COVID-19 cases, 38,945 discharges, while 12,280 cases are said to remain active. Here's a breakdown of the latest cases, with Lagos recording 130, Bauchi 36, FCT 25, Edo 17, Bayelsa, Ogun and Oyo 14, Anambra 13, Kaduna 12, Ondo 11, Abia 10, Osun 6, Plateau and Kwara 5 each, Kano 4, Ebonyi 3, Sokoto 2, and Borno State with 1 case. Meanwhile, the Lagos State Commissioner for Health, Professor Akin Abayomi, is responding well to treatment after testing positive for COVID-19. Professor Abayomi, who earlier confirmed his status via a tweet from his official Twitter handle, says he will continue to discharge his duties as the Deputy Incident Commander for COVID-19 response in Lagos. Well, this is coming after several months of battling to save lives and prevent infections in Nigeria's epicenter of COVID-19, accounting for over 30% of the total confirmed cases in Nigeria. Another statement from the Commissioner for Information and Strategy, Mr. Gbenga Motosho, says Professor Abayomi became aware of his status following the required testing protocol of contact tracing procedures. He is asymptomatic and will be cared for in line with the Lagos State home-based protocol. Everyone is at risk. Well, that is one of the major messages from today's Presidential Task Force briefing on COVID-19 holding in Abuja, the nation's capital. The chairman of the PTF and the secretary to the government of the Federation, Mr. Boss Mustafa, while updating Nigerians on the nation's response so far, says that the virus is no respecter of persons and stigmatization should have no place in the society. Meanwhile, as the nation prepares to open its airspace to international travel, the PTF says that measures will be put in place to ensure validity of the pre-boarding test certificates presented to the airlines by those coming into the country. This has become necessary because of the 404 confirmed cases in Lagos on Saturday. 64% came from evacuees returning from other countries.
Unfortunately, the validation process for the pre-boarding PCR tests have shown, for instance, in Lagos, that out of the confirmed cases in Lagos on Saturday, 28th, that stood at 404 of those cases. 64% of that infection came from all manners of evacuees and the people who were returning from other countries for the purposes of going back to their places of work. That is a major source of concern that the Presidential Task Force will be looking at critically in the coming days and months, so that we ensure the validity of the pre-boarding test certificates that are presented to the airlines. The Presidential Task Force has already informed you about the plans to reopen the international airspace for flights in a manner that will promote safety, security, and economic recovery for our nation. We have been working with other sectors to develop appropriate protocols that would ensure that we do not open at the expense of getting new infections being imported into the country.
And if the concerns about the government over the spread of COVID-19 in the country is anything to go by, then the government may have to re-strategize ways to reduce the rising daily increase in reported cases of the virus. A roving report by a correspondent today reveals that many people have totally neglected the COVID-19 protocols of wearing face masks and maintaining social distancing in the wake of the extension of the East lockdown. While some people believe the virus is still out there, others don't. Let's head over to Osun State, where despite the compulsory use of face masks, social distancing, amongst other measures put in place to reduce the spread of COVID-19, the attitude of residents towards obeying these directives remains a huge task. So far, 1,624 positive cases have been recorded in the state since Nigeria's index case of a pandemic was reported in February. About 1,410 patients have been discharged. 17 are currently on admission at the Olabisi Onabanjo Teaching Hospital, Shagamu, and the Federal Medical Center, Abeokuta, the state capital, while 26 fatalities have been recorded in the state.
People are taking things for granted, believing that life has returned back to normal, not taking into cognizance the need to abide by the guidelines to keep social distance or physical distancing, and to also maintain personal hygiene at the topmost level. And so also, people are actually not taking responsibility. To some, they still feel that it is a scam. It doesn't exist, or it only exists with the political class, or it does not even. It is not near us, or our immunity is capable of sending it away. So we have so many many thoughts. So I think to flatten the curve the more, it is for us to encourage critical stakeholders like the religious organization, even the market association, and those who engage in day-to-day management of crowd. They should ensure that all these guidelines are strictly adhered to.
And over to Benue State, where the Chief Medical Director of the Benue State Teaching Hospital, Professor Terlumen, is calling on government for sustained investment in the health sector, as done in the last 6 months at all levels, to improve the capacity of Nigerian health system and workers for effective service delivery. Professor Swende made the call while speaking to Channels Television on the successful management of nearly 200 COVID-19 patients since the arrival of the pandemic in Benue State on March the 27th, noting that his team has been one of good examples of a functional team. The total confirmed cases of COVID-19 in the state stands at 430, with less than 10 casualties recorded from the 2 main isolation centers.
We have over 400 confirmed cases in Benue. However, we've received and managed 156 of them here at the Teaching Hospital Isolation Center. Of these, we have successfully treated and sent home in good condition 130 of them. We have 19 active cases as we speak, being managed behind us. Unfortunately, we had 6 mortalities here, and 1 patient was referred out. That has been in terms of statistics. Again, what we witness here is not different from what we are seeing elsewhere. The vast majority of patients that are coming with mild disease, as they have no symptoms or mild symptoms, and invariably they get to do well. A few of them come in with a great respiratory challenge, in fact, some in failure. We'll be able to win the battle with some, and in 6 instances, we were not able to.
Well, Mr. Musa Hassan joins us from our Abuja studio this evening. He is a medical laboratory scientist. It's great to have you on the show this evening.
Good evening.
Well, first off, the PTF on COVID-19 is concerned about the validity of pre-boarding test results. I mean, Nigeria is opening its airspace to international travel in the coming days. And it begs the question, just how easy or how hard is it to procure a test result?
Now, it has been a challenge, actually, because one thing I can say, going by the update of today, that is so encouraging is the PTF is encouraging states to also build up their testing capacity for testing for COVID-19 and standardization. They also spoke about how to standardize the result that is coming from the lab. It also tells you that the equipment, that is the PCR we are talking about, it is of different grades. There are some that are manual, there are some that are real-time, and in the process, we need to make sure that all laboratories have the real-time PCR or standardized so that we will not be having discordance or conflicting results, because I am aware that there are some Nigerians that travel in, they will be complaining testing negative, and when they come to the country, after subjected to test, they will be positive. And they always complain about that, and it is the testing method, because some other countries use a rapid diagnostic test kit with low sensitivity and specificity, but the PCR is able to pick more. That is, no matter how, there's what we call infection dose. No matter how low is the viral load, the real-time PCR will be able to pick. So if you are coming from a country with, that uses something like rapid diagnostic kit with low sensitivity and you are tested negative, if you come to Nigeria, you are likely to be tested positive. But the greatest challenge, and I want to tell you something that will amaze you, the cost of producing or the cost of creating a laboratory testing site, is far less than 50 million. And imagine all our senatorial region establish one testing site. That's you are going to have about 109 testing sites. Now, one testing site will be able to run minimum of 3,000 tests, or even at least you run 1,000 tests. If you multiply it, you will be having more than 109 Nigerians tested positive, being tested for COVID-19. Right. But the problem that we are having, why you see most Nigerians are not also believing that COVID-19 exists, because if you go to some local government, there's nothing like testing, there's nothing like isolation center, there's nothing that will show the community that something like COVID-19 exists, and truly COVID-19 exists. And today I saw in your statistic, you mentioned 322 cases confirmed. And that's probably because most of the local governments and state governments are not running this test. It's only the few centers that run this test that is able to extract 332 cases that are positive. Imagine each local government run this test, and you can imagine how many positive cases you start getting it. So for me, the most important thing is to scale up testing through establishing more laboratories across the state, across the senatorial regions, and across the local government areas of the country.
You know, I like the fact that you identified one of the two major problems, which is capacity and people actually coming forward to get tested. Mr. Musa Hassan, thank you so much for your thoughts on the program. So, can a person get reinfected with COVID-19? Well, we'll tell you about a research from Hong Kong and what the WHO has to say about it. That's when we return. Please stay with us. You're welcome back. Well, let's speak with Dr. Olukunle Balogun. She's a public health physician. She joins us via Skype from Ife in Osun State. It's great to have you on the program.
Thank you. Good evening.
Well, good evening. We've listened to the PTF on COVID-19 speak, and for you, as a committee member of the task force on COVID-19 in your locality, I'd like to know, have you been able to demystify these compliance and awareness issue, because it's still a major deal if you go across states and, in fact, across countries? Is this something you've been able to demystify where you are?
Yes, you're absolutely right with that observation. And what we are considering, or what we have considered as public health physicians, and myself personally as an epidemiologist, looking at the trend globally, and especially in Nigeria, is that our people have what we call a reduced risk perception. In public health, we consider what is called the health belief model. And the health belief model looks at perceived susceptibility, perceived severity, perceived benefits, and perceived barriers to health events like the ongoing pandemic and health interventions. Most Nigerians have a reduced risk perception about COVID-19, because looking at the trend, they assume, or they have concluded, that it is elitist in its occurrence. Looking at the cases that we've been seeing, they're in, ministers, governors, personalities that are in high places, and they feel this thing is far from us. For those that are in rural areas, they feel that it is an urban problem. And for what we have seen, it is a global problem. And in Nigeria, it is a national issue. In fact, it's a national emergency. So it is important that our people increase their perception of risk. COVID-19 can happen to anybody. It's not just the governors or the politicians or the ministers or the commissioners. It can happen to anybody. It's been happening in children. It's been happening in pregnant women, the elderly. So it is important that we change our mindset and increase awareness, increase our level of suspicion. As health workers, we've been doing that. Right now in most hospitals, COVID-19 is a differential for people that are coming with a fever or any complaints that are similar to the signs and symptoms that we've seen typical of COVID-19.
Right.
So our health education must continue, and we must also intensify social mobilization at the local level.
Right.
We need to use our structures, the social mobilization structures that we use for other health programs, to increase awareness and health education about COVID-19.
Which is perhaps why the PTF has said that everyone is at risk. But you mentioned vulnerable groups. You talked about the elderly and the pregnant women, and I'd like to just touch on that, briefly. We need to protect them clearly, but also how do we ensure that while protecting them, you ensure that they get good quality life? If you know what I mean, they live the life as they ought to, exercise, engage in activities they ought to. How do we balance that? Because I think it's been a major challenge.
Yeah, it's possible, and it's still all about health education and health information. Okay, the health information we need to share with our citizens is the fact that they also need to improve their nutrition, take a lot of fruits, take a lot of vegetables, wash your hands, use face mask when you're in public. And now that schools, we also have to look at young persons because they are vulnerable as well. Now that schools have resumed, before children leave home, the parents need to remind them, use your face mask when you get to school, wash your hands. After you're done with your exams, wash your hands. For pregnant women, most of the information is shared at antenatal clinics.
Right.
And essential services have been restored in most health facilities across the country, so that information is available to them. For the elderly, a lot of elderly persons, they watch television, they listen to the radio, and across stations on radio and channels on TV, most of this information is passed across. So we can only continue because there are some people who don't have this information, and it might just be the day that they are listening, to the news, that they get the information. So that's why I said we need to go to the community level. So we need to go to markets. The faith-based organizations need to also intensify their health education, and we just need to continue until this pandemic is over. Advocacy, social mobilization, health education is a continuous process.
And we shall never get tired. Well, Dr. Olukunle, thank you so much for those thoughts on the program this evening. We do appreciate you.
Thank you for having me.
Well, Hong Kong University scientists have reported the case of an apparently young, healthy patient being reinfected with COVID-19. And this happened 4.5 months after the first infection. Well, using genome sequencing, they discovered that the second bout or the virus was different from the first infection rather than just a continuation or reemergence of the original one. But then the World Health Organization says that organizations and people generally should not jump to conclusion as of this point, not using one person's experience to judge 23 million people. Here is more on our global update.
South Korea has mandated residents in the capital, Seoul, to wear face masks in both indoor and outdoor public places for the first time as the country battles a surge in coronavirus cases centered in the densely populated city region. It was only back in May that the government had ordered that face masks be worn on public transport and taxis. But the latest spike in cases has officials worried that the country may need to impose its highest level of social distancing. Mexico has the third highest number of COVID-19 related deaths after the United States and Brazil. But President Andrés Manuel López Obrador says the pandemic is waning after the weekly COVID-related death toll for week 33 continued on a downward trend. The president made the announcement a day after the total death toll in the country surpassed the 60,000 mark. Spain is also mulling over restrictions on mass mobility among autonomous communities as COVID-19 surges across the country. The country had reported 386,054 confirmed COVID-19 cases on Friday, with the total fatalities reaching 28,838. Madrid, the capital, is still the region with the highest number of cases. It experienced 5 rounds of local spikes in COVID-19 infections on Saturday, with 74 confirmed cases, 217 close contacts, and 1 death. Italy has begun the first human trial of its own potential COVID-19 vaccine, as new cases in the country continue to rise steadily. The experimentation, developed by a team of Spallanzani researchers and clinicians in collaboration with Raythera, an Italian biopharmaceutical company, will be carried out on 90 volunteers divided into 2 age groups, 45 between 18 and 55 years, and the same number over the age of 65. Preliminary results of the trial are expected by the end of 2020. In Ghana, the World Health Organization is providing support to the health service in their efforts to continue providing essential medical services to the population. Health worker safety is a critical component in the COVID-19 response, as more than 10,000 health workers in 40 African countries have contracted the virus since the pandemic began.
People were afraid to go to health services, thinking that it isn't a place where they may actually get into contact with people with COVID. So because of that fear, even people who needed to access health services were fearful to go.
Finally, people across India are finding ways to cope with the COVID-19 pandemic as the government looks to start reopening the country after months of lockdowns. As at Sunday, the number of confirmed cases in India reached over 3 million, the world's third highest after the United States and Brazil.
Well, that's the COVID-19 update. Thank you so much for watching. I am Kayode Okikelu. Do stay safe.